Can prednisone cause thyroid changes? Your thyroid is this organ right here, and it is important for a lot of things. So does prednisone affect it? I'm Dr. Megan, your prednisone pharmacist, and I'm here to talk to you about some potential things that can happen when you take prednisone and how it might affect your thyroid. So your thyroid is this organ that helps with so many things. It helps with your heart rhythm. It helps with your energy metabolism. It helps with your temperature regulation. It helps with your hair thickness, your skin, your gut. Like it is this basically like a little thermostat across your whole body, helping keep things in balance. And when the thyroid isn't working right, everything kind of falls apart. And so I am here to say that prednisone does affect your thyroid, but it is unpredictable. It doesn't affect everyone. This is one of those more rare side effects, but it is a legitimate side effect. I found studies going all the way back to 1978 showing this connection between taking prednisone and thyroid changes. So when it comes to the thyroid, there's hyperthyroid and hypothyroid. Hypothyroid means low thyroid. That's a way more common situation than hyperthyroid, which means high thyroid. And so what is more common when it comes to prednisone changes? Usually hypothyroid changes are more common, and that can be associated with weird temperature, weight gain, just lots of weird things that happen. And you're like, I don't feel like myself. Could be the prednisone alone, but it could also be the thyroid. What about the hyperthyroid? Hyperthyroid is associated with feeling hot, just unable to tolerate heat, like going outside in the heat, having hair loss, having heart arrhythmias, having diarrhea or constipation. Usually the hypo is with constipation. It could be skin thinning, shaky hands, problems sleeping. So just feeling yucky all the time and unable to feel restful. If it's extreme, you can get like bulging eyes, like they're like popping out of the eye sockets. That's a really bad complication of thyroid issues. That can happen. And then confusion can happen with either of them. Just brain fog, not really able to process things like you normally do. Granted, again, a lot of these side effects can be just because of the prednisone itself. But if you're seeing a connection with all those symptoms, it can't hurt to have your thyroid tested. So what should you do? Well, you should go to your doctor and you should ask for your thyroid to be tested. And they'll probably pull some, ask you a lot of questions about your symptoms, and then they'll draw some blood. And the blood tests I recommend, including at the very least a TSH, thyroid stimulating hormone. And then we need a T3 and a T4. It would be nice if we had a total and a free of both of those, but some labs don't do that. So that's what I would recommend at the very least. And then some other labs that would be helpful, I'm just pulling them up on my screen here, include a thyroid peroxidase antibody and a thyroglobulin. Those would be helpful as well to figure out what exactly is causing your thyroid issues, because it's strange. You can go up and down and back and forth in between all of these symptoms as your thyroid is being affected, as the inflammation changes. What other things are interesting is that prednisone itself can be used as a treatment for certain thyroid issues. For example, Graves' disease, I was referring to the eyeball thing. It can actually help to shrink the eyeballs back down. It can help with thyrotoxicosis and help people to get out of hyperthyroidism. So prednisone can help with certain thyroid issues. So it can cause thyroid issues and it can help with certain thyroid issues. And that's pretty typical for prednisone. It can cause blood problems. It can help treat blood problems. It can cause mental changes, and it can help with neurological changes. Prednisone is this amazing miracle drug, but it's like a two-edged sword. It can cause similar problems to what it treats. So now that you know what labs to test, that it can be used for both treatment and it can be the cause, what should you do next? Well, you should probably get a treatment. And if it's I think I was on this side, hypothyroidism, they usually give you replacement thyroid hormone. And that's usually levothyroxine. Sometimes they'll do and that's the same thing as T4. And they might also do liothyronine, which is T3. It all depends on your endocrinologist and your own personal situation. And then you might, as your prednisone dose changes, you might also need changes in your thyroid dose. So every time you change your prednisone dose, about 6 to 8 weeks later, you might need to check your thyroid to make sure that it's still the appropriate dose for you. For hyperthyroidism, high thyroid, you probably need treatment either with methimazole, that's usually the first treatment of choice, propylthiouracil, or they can even give you radioactive iodine. It's like a nuclear option where they're actually giving you radiation in a pill, and it goes to your thyroid, and it essentially like kills off your thyroid so it can stop killing you. And then finally, the fourth option is surgery, where they actually remove your thyroid gland. That's also how they would usually treat thyroid cancer, are those similar treatment strategies. So if you are having these weird side effects, or you took prednisone a while ago and you're still having like hair loss, temperature weirdness, heart palpitations, and you're like, I just still don't feel right, brain fog, get your thyroid checked. You might have some subclinical hypothyroidism or hyperthyroidism or other changes. And also what's interesting when it comes to your thyroid is the most common type of thyroid change is autoimmune. And people are often taking prednisone for an autoimmune condition, usually not the same one. But once you have one autoimmune disease, you're more likely to get another autoimmune disease and then another. And so because you took the prednisone might not be the reason you're getting thyroid changes. It might just be that you have an autoimmune, genetic situation, and you had one and you took prednisone for it. You have another one, and now you're getting the thyroid as one of those autoimmune conditions. So is prednisone the cause? Potentially. Is your chronic disease that you're taking prednisone for the cause? Potentially. Is really hard to get to the root cause. But no matter what, it can't hurt to get your test done to find out if that's really what issue you're dealing with. So I'm Dr. Megan, your prednisone pharmacist. And if you have questions about other side effects, check out my ultimate list of prednisone side effects to see if what you're feeling is actually a side effect. Signing off, Dr. Megan, your prednisone pharmacist.